5 on your health, we're focusing on sickle cell disease. It is a painful inherited condition that primarily affects African Americans.
Here with some insight is Dr. Shal Azar, the medical director at the MGH Comprehensive Sickle Cell Disease Center. Dr. Azar, thank you so much for joining us this morning. For those who might not know, tell us what sickle cell disease is and what it does to the body.
Well, good morning, and thank you so much for having us and for focusing on the disease. It is Sickle Cell Awareness Month. Sickle cell disease is, as you mentioned, an inherited blood disorder. It affects about 100,000 people in the United States alone, although that number hasn't changed in 30 years, largely because we are so far behind in our understanding of the disease that we don't even know how many people are actually affected. 1 in every 365 Black Americans is born with the disease. 1 in every 15,000 Latinx Americans is born with the disease. The hallmark is severe pain. Many of our patients describe it as the sensation of broken glass being poured through their veins or their bones breaking from the inside. But really, it's a disease that affects every organ in the body. Our patients are prone to stroke, heart attack, broken bones, kidney disease, teens, 20s, and 30s.
With those sort of outcomes, how do you feel about this? The big news this week was that Pfizer suddenly pulled off the market one of the major drugs to treat it. So what are you telling your patients?
So the drug in question here is Voxelotor, or brand name Oxbryta. And it felt like a major setback this week, and it was a major setback this week. What's important for our patients to know is that the drug company voluntarily pulled the drug off the market. We don't know what has driven this disease entirely yet, but from what we do know, it seems to be based off of safety concerns from data that the company has been gathering since the drug was approved here in the United States. Our team at the Massachusetts General Hospital Sickle Cell Center and my colleagues around the country have been busily reaching out to patients who are on the medication over the course of the last few days. If you are on Oxbryta and you have not yet heard from your sickle cell team, it's important that you reach out to them or to your hematologist as soon as possible. It's also really important to know that you should not stop the medication suddenly on your own. We need to help you taper safely off the medication. And lastly, it's really important to know that this does not apply to other disease-modifying therapies, other drugs that you're taking for your sickle cell disease, like hydroxyurea. You should stay on those medications.
Good to make that note. Obviously, more research is needed, and a big part of advancing research is raising awareness. What do you want people to know about this disease, even if they're not personally impacted by it?
I think it's really important for folks to realize that sickle cell disease is really the hallmark of the intrinsic racism within our healthcare system. We are miles behind because this is largely a disease that impacts Black and brown people. And while it's a genetic disease and a molecular disease, it's a systems disease. I really want our patients out there and their families who may have heard the news this week to know that we are not giving up hope. There are newer and better treatments coming down the pipeline. The door on sickle cell disease has been kicked open, and we are not going to allow it to close again.
Is there a short answer on why it affects people of color mostly?
Yes, so the disease actually is prone to follow the malaria belt around the world. It's been preserved in our genetics because people who are carriers of the disease are protected against malaria. So it affects people in sub-Saharan Africa, the Middle East, the Indian subcontinent, the Caribbean, and Latin America mostly.
Okay, thank you, Dr. Azar. Very good information. Have a good weekend.
Thank you so much.
Thanks.